Want we zijn nu uiteraard wel benieuwd om te zien hoe dit zich vertaalt naar de praktijk. En daar gaat Denise Cahill, Coordinator Healthy Cities in Cork, Ierland, ons meer over vertellen.
Thank you. I'm going to speak into this mic, if that's okay. Okay. So my name is Denise Cahill. I'm the Healthy Cities Coordinator for the City of Cork in the Republic of Ireland. And my contact details are here if anybody wants to get in touch with me after the presentation. Cork has been a member of the network that Ciara so eloquently presented to you since 2012. So we're 12 years designated by the World Health Organization, and what that has evolved, I suppose, over the last 12 years is an understanding that being a healthy city isn't an end point, it's actually a starting point, and designation really is about starting the process of putting health at the heart of city planning. So a healthy city isn't one that has done everything and has their job done, takes the certificate and walks away thinking this is great, we're fantastic. It's actually a commitment to really putting her health into city life. So it's a process, not an outcome. And it really is about a city being conscious of and striving for health. And that was something, I guess, 14 years ago when we sat down and said, let's go for this designation, we really talked about, that this wasn't just a celebration event where, we get our designation and we're done and dusted. We really wanted to emphasise that it was a starting point, and it has been a starting point. And I guess it's about pivoting and reacting and working with where you're at any given time. When I was in college and I was studying health promotion, there was a lot of talk about upstream and downstream in the health service and in health delivery. And I guess the theoretical nature of this learning was really interesting, but it's only since I've been working in this area for the last 15 years that I really understand this concept of working upstream. Because I'm employed by the health service in Ireland, but I do absolutely nothing in the health service. All of my work is outside of the health service. It's entirely outside of the health service. So when I'm explaining to people who don't work in my area about my work, I use the analogy of, a medical student leaving the university in Cork, walking down the streets of Cork and see somebody drowning in the river. They might intervene and rescue the person, resuscitate them, treat them. But then another person might come down the river and they go and intervene again, and they keep intervening and they keep intervening. They don't have the time to stop and say, what's going on that all these people are coming down the river? And I guess that's the luxury of my job. I do have that opportunity. I do have that role of saying, why is it that people are constantly coming through this service in need of resuscitation? And in that analogy of people coming down the river drowning, you might say there's something going on upstream, there's something happening on the bridge, for example, maybe there's a problem with it, the people are falling in. And if that is the case, it's not a medical doctor or a nurse or a healthcare professional that you'd engage to fix the problem. It's actually an engineer, or it might be a community development project to let people know don't cross the river. Or it might be the local police force to close the road and make sure nobody crosses the river. And suddenly you have a whole group of people intervening to protect people from coming down into the river and, I suppose, flooding the health service at the end. And that's effectively what my job is. It's to bring those people together upstream on the bridge. So Ciara mentioned the 6 Ps, and the framework of the WHO Healthy Cities is something that we've had to adopt in Cork. And the 6 Ps gives us a great structure to action plan. So it's all well and good to say our city's committed to health and making big declarations, but in practice, what does that actually mean? So what we have done is we've created an action plan for 10 years from 2020 to 2030. And we've used the 6 Ps of the Copenhagen Consensus. So the framework is there and the structure is there for us. And each of our actions in our action plan has the Sustainable Development Goals aligned to it. So this is about making sure that it's not lip service. This is about making sure that the actions are tangible and real and effective in terms of sustainability. Traditionally, professionals work in silos, and I work in the health service. Even though I don't work in the health service, I work for the health service. I see that silo-based approach every single day. We're trained to work in a certain way. We're trained to think in a certain way. Our cultures facilitate us to operate in silos. And some of that comes down to professional boundaries and maybe protecting our boundaries, protecting our qualifications. But I would argue that the generalist is more important than anybody else. That ability to cross across the silos and work with the strengths of each sector is the most important and most effective approach. So when I'm asked again to describe my job upstream, I equate it to that of a honeybee that cross-pollinates ideas from different sectors. And if this is a drawing that was done when I once spoke about my job, and I've used it ever since. It's the Medici effect. It's that whole thing of reframing people's perspectives, because we all have a perspective, and I challenge you today to even think outside of your own box and think beyond what you do in your day-to-day to see how you can be more effective, because diversity is the source of creativity. When you bring diverse thinking and diverse approaches, you can be really effective. We talk a lot about the social determinants of health, and I have seen this. I've worked in health promotion for 25 years. I've seen this in health policies in Ireland, across Europe, references to the social determinants of health at the first page of every policy document, and then it disappears. And that's the reality. Because we get stuck into lifestyle-based approaches, low-hanging fruit, simple measures, things that are politically digestible and acceptable. And we lose the emphasis on the social determinants of health. But what's fantastic from the perspective of a healthy city is that it's embedded within the framework. You cannot avoid it. You cannot move away from it. You have got to focus on it. And I use this image because in an hour in Cork City, 3 babies are born every hour in our local maternity hospital. And as Ciara very eloquently put it, their genetic code, their air code is far more important than their genetic code. So what happens for those babies in the first 5 years in particular of their lives will have more of an impact than anything else. And where those babies go in communities and in societies is more important. So how do you translate all that theory and evidence and structure and frameworks into reality? So I'm just going to give you a sense of how we take the social determinants of health seriously in Cork. What we've done is, and it's part of our designation as a WHO healthy city, is we take a temperature check every 4 years. So we carry out a city profile. Now, traditionally, a health profile, and I used to work in public health, a health profile is full of diseases. It's full of rates of cancer, rates of cardiovascular disease, rates of diabetes. But we decided to switch that approach and look at the social determinants of health. So our city profile takes the lens of the social determinants of health in order to use it as an education tool, but also to see what's happening in the city. And we look at every electoral district in the city. And out of that electoral district analysis, we put the lens of the social determinants. So we're looking at education levels, we're looking at employment levels, we're looking at housing and transport. We're looking at how people perceive their health, as well as looking at the diseases. So sometimes we lose the knowledge by just looking at the diseases. And then in section 2 or section 1, we look at the whole city and what's happening as a whole. And you can see here in these graphs that there's practically mirror images across the city of what's going on. So this is a map of Cork City. You can see there's areas of our city that have higher levels, shaded in dark blue and navy. And these patterns are practically identical, but each map tells a different, is looking at a different dimension. I think the top left is looking at education, low levels of education. The middle one is about employment, unemployment, so education tied with unemployment. The next one is around the number of lone parents. The bottom left is disadvantage, and the bottom right is how people rate their health. So suddenly you're seeing patterns of inequality, geographical patterns, and you're seeing that there's particular areas of the city that have particularly high levels of disadvantage. And with that, you're making a case for better investment. What we do with that city profile is we use it as an education tool for political leaders and for decision makers and for organisations to say, if we could improve on education levels and we can improve on employment, then we can start to improve health. An area that we're currently working on, just to give you a tangible example from an area of nutrition and healthy eating, is the Cork Food Policy Council. So when I trained in health promotion, all I learned about in terms of nutrition was the food pyramid. If we could just eat the food pyramid, we'd all be fine. 1%, in fact, I think it's less than 1% of the Irish population follow the food pyramid guidelines, because telling people what to do is not sufficient. In fact, it's completely ineffective. And for many years, we have invested a lot in communicating the key health messages, which of course are important, but it needs to go beyond that. When you look at the food system, it's a massive, complex area, and there's no one person knows it all. And this is why I believe that it's a nettle that people are slow to grasp, because it's such a complex area. If we look at the food system internationally, 850 million people are hungry in this world. 125 million children have stunted growth from malnutrition. 2 billion suffer from micronutrient deficiency, and 2 billion people are overweight and obese. That alone should tell you that our food system is not working. There's a massive rise in big food, and there's marketing budgets for many corporations that swamp the public health messages of the food pyramid that we try to put out. There's also a transition in terms of our diets and a meatification, and there's increased sugar, saturated fats and salt, in other words, ultra-processed foods. We've rising obesity levels, as Julianne presented earlier, and type 2 diabetes and other non-communicable diseases across the world. So what we're trying to do in Cork is to reimagine the food system. And we have to look at it in an Irish context, because it's at national level that a lot of policy decisions are made. The current roadmap in Ireland is that we regard Ireland as a production platform for 7 million cattle. So there's more cows in Ireland than there are human beings. And we're scaling up farm sizes because beef is where we have put a lot of investment. But we're a society as well as an economy, and that's the space that we're trying to operate in terms of food policy in Cork. We also face the prospect of severe climate change impacts in terms of the agri-food system. And we believe that food can be part of a civic renewal and looking at how we can be a society as well as an economy. The policy context in Ireland is that there is no food policy. We've an agro-food policy, with agro-exports being the priority and very much the focus. The environmental context of that is that agriculture in Ireland is 1/3 of greenhouse gas emissions. It's a massive issue. Our water quality is being damaged. The EPA water quality reports are demonstrating that. And there's a collapse in our pristine river levels. And as is globally, we've massive biodiversity loss, with a loss of bird species in particular. There's a growing disconnect between what we produce and what we eat. Our imports are greater than our exports in terms of food calories. 1 in 4 adults in Ireland is obese, and we're going to have the highest obesity rates in Europe by 2030. And 500,000 people are defined as food poor at the same time. 2/3 of Irish farms are not economically viable. So the Irish context, as well as the global context of the food system, is saying that something needs to shift. So what we're trying to do is do it from a city region and focus where we can in terms of local action. Because as Ciara said earlier, it's at local level that you can pivot and respond a bit more. So city regions offer huge potential for co-designing policies. We want to shorten food supply chains at city level. We want to look at providing public land for urban food growing and public procurement schemes that look at locally grown food. We want to try and get organic food into hospitals, and we want to support city-based initiatives such as farmers markets, social enterprises, food festivals and community food programmes. And we want to diversify the retail offering by facilitating local farmers. Healthy communities, reconnecting health with food and food with health and communities with food. So we established 10 years ago the Cork Food Policy Council, which began as a small project in a disadvantaged area of Cork City known as Knocknaheeny, where there was a small investment for a community food initiative. And following evaluation 3 years later, it was decided that in order for this to have an impact, we needed to work at a city level. So in March 2014, we decided to launch a food policy council for the city. And with that, we rescued 1 ton of vegetables that were going to go to landfill because the vegetables were the wrong shape and the supermarkets refused to sell them, to demonstrate the crazy situation of waste, food waste in our system. And with that 1 ton of veg, which we cooked up on the main street in Cork City, we fed 5,000 people bowls of curry on the street. And with it, we got a national media campaign and an awareness of this waste. We host annual awards to really champion the heroes of the food system, the people in the education sector, so the schools and universities, the businesses that are out there, and the community groups that are working against the odds to really build a sustainable and healthy food system in Cork. We did a food map and we had a look at what's going on in terms of food in Cork City. And of course, the trouble with doing a map is the minute it's done, it's out of date because businesses go out of business and things change. But what it gave us was a snapshot at a point in time of what was happening around food in our city. And the thing that we noticed the most is that community growing spaces were very limited. So we managed to secure funding from a health budget, a tiny budget, to hire 1 individual to really get involved in developing community growing spaces. And with that, we have established a project called Green Spaces for Health, which has built an entire structure around community food growing, using a permacultural approach, which is about working with nature, working with people, and working with animals. It's kind of I guess it's what the WHO would say, a One Health approach, of working around communities and growing food and I guess activating communities in this space. With that has come outdoor education and experimentation. So looking at protein alternatives, looking at what we can grow in our Irish climate at community level. Looking at beans that were perhaps never grown here before, sampling different things, and that was amaranth, which had come from Mexico. So within the space of 3 to 4 years, we now have 27 community growing spaces across the city. We went from begging Cork City Council, our local municipality, for land for communities to an absolute full 360-degree turn of them coming to us saying, can you support this community for us? We will provide the land. So we have built a credibility, I guess, and a confidence that the approach is appropriate and is effective, and communities are becoming energised in the process. This is a solidarity garden, which was established for people who have arrived in Ireland looking for asylum. And this is around growing food from their countries. So not only the process of growing the food, but also sharing and engaging. And that's the approach that each of the community gardens takes. You don't just learn about growing food. You don't just learn about maintaining and managing these spaces and harvesting the food. You also share the food together. And I guess with that, you get really good integration and intersectoral and communication and engagement and social inclusion. What we are now attempting to do is use the Place Standard tool, which is developed by Public Health Scotland, to look at spaces and places and put a health lens on it. And we're adapting that tool for the food environment. So we're now examining spaces around what's going on in terms of food. So we're evolving the food map that we did on the city to really get into communities to see what's going on around food. Is there food deserts? Is there food surplus? Is there access to good, healthy food? And really getting under it to see what can we do to create a more supportive environment for healthy food. And we're piloting that at the moment, so we'll be publishing a case study on that next year. We've also been invited into Feast, which is a Horizon project, European funded. The city of Ghent is one of the living labs in this project as well. And with that, we've managed to be provided with funding to hire a development worker. And that development worker has 2 jobs. We're now developing a food policy for Cork City. It's taken us 10 years. We've gotten the commitment at municipal level to a sustainable and healthy food policy for the city, but also to develop a food hub. And with that, we're going to look at providing food at a local level, providing space for growers to thrive and to come together in a cooperative approach, and to provide food, hopefully initially to hospitals, but also to local communities. We're going to further develop community food growing and evolve it. Our community food growing spaces have grown exponentially, as I mentioned. There's 27 now across the city. We now want to step that up into market gardening because the yield from a community garden is not high enough to feed a community. So we're looking for funding to develop a market garden and to pilot that in one particular community. And we're really looking forward, I guess, to collaborating in this Feast project to present our research. So we've carried out a review of other European citywide food policies. We've presented to our local community development committee to say we're developing this policy and we've gotten their engagement. We're carrying out community and stakeholder engagement workshops. We've 13 planned for the next 6 months. And there we'll really be bringing the policy into reality for people because health policy and food policy can be very theoretical. We want to get into communities and really hear what they have to say about food. And so far the engagement has been really, really good and there's a huge amount of interest. We're going to do a food mapping using the Place Standard tool. And then next year, we hope to hold a citizens' jury, equivalent, I suppose, on a smaller scale to a citizens' assembly, to present back to maybe about 20 citizens the findings of our community engagements, to hear their views and to get their choices in terms of what they'd like to see in our local food policy. And we hope to have that developed by this time next year. So thank you very much. I'm very happy to take questions.